Hi. Hi. I Dr. Tarun Zada. I'm back again, once again, on this channel of Surgery Simplified just for students. Well, it was a big break. Not many videos you must have seen. And the earlier videos, you must have not ever seen, not even seen my face. The reason being, predominantly, this was earlier the channel for the students, by the students, managed by me. Okay. So now, why me? Why am I coming after such a long time? Well, earlier I couldn't make it because I was pretty much occupied into teaching physically. Well, now I'm teaching physically to my students. But then now I have just felt the need that because I'm out of Mumbai and I have seen multiple colleges, I've seen how teaching happens, I've seen how the difficulties the students are encountering. I think the teacher in me is now possibly having a lot of desire to connect with a lot of the students to create many myths, many doubts, and many difficulties and help them with the tips and tricks so that they move ahead and practice homeopathy with full zeal, zest, and confidence. Well, why? Now you might say that in some rural areas, homeopathy cannot be practiced. And in some areas, you can. But then trust me, it's not just about you can or you cannot practice homeopathy. It's also about how much knowledge you're able to have. And I believe if all the more knowledge you have about understanding the pathological conditions, managing the pathological conditions, understanding how the pathology can be managed, that is happens when you understand how surgical cases can be managed with full confidence, which definitely will not come in your earlier years. It will come later gradually, and that also with practice. So when you start getting those small, confidence giving cases, you will build up your own practice with homeopathy in even those rural areas. And then obviously, my intention of having people in the rural also practicing homeopathy is set. Well, this platform over here is for connecting not just with the students or to help them guide with their surgical topics, but also is here to help you through my learnings, what I have learned over the years, what are the tips that I can give you, what are the tricks that I can tell you how to manage certain cases. Certain cases, surgical cases, meaning predominantly surgery, the topics that you have in your exams, surgery, general surgery, ortho, ENT, dental, ophthalm, all those topics, but with a homeopathic point of view. How you are now in these cases going to understand the scope and limitation of homeopathy. Well, if that's understood by you, then most of the work is done. You are all set to appear for your exam, clear them, and manage all the pathology when you are setting up your own practice. Well, this channel is now set to be rolling on with me in presence physically to help you through it. If in case you end up with any doubts over here, or if you have any particular topic in your mind that you would want me to take up, do mention in the comments below. Because even if I'm teaching physically in certain areas, I may not be able to because of time crunches, because of your syllabus. I may not be able to cover up certain topics. So, well, if you have some topics that you definitely need from my side, do let me know. It's all the more a pleasure for me to cover up those topics so that the ultimate aim is served. Okay, so sooner or later, the topics will be added on a regular basis. I mean, it's not sooner or later; it's going to happen. Weekly, minimum two topics will be put up. Hope you go through them. Hope you enjoy them and stay connected.